we're going to talk about the brain. Some of the gross anatomy, the features, some of the more in-depth inside within the brain, and as well as the 12 cranial nerves we need to know. Okay. We'll talk about some of the features that are visible just looking at the brain. You have your gyrus or gyrus, which are the ridges on top of the cerebrum, which are formed by the sulcus, these small indentions here. And we have larger indentions or grooves, which are the fissures. So we have our longitudinal fissure, this deep groove here, which separates the right and left cerebral hemispheres. We also have a transverse fissure, which separates the cerebrum from the cerebellum down here. We have a couple main sulcuses. We have our central sulcus, which separates your pre-central gyrus and your post-central gyrus. Yeah, make sure the brain is set up correct. Same on this side. Pre-central gyrus, post-central gyrus separates your front motor, back sensory. You have your primary somatosensory cortex and your primary motor cortex in the back here. Again, like we said, your central sulcus comes down to your lateral sulcus here, which separates some of the lobes. Our four lobes are frontal lobe, parietal lobe, and your occipital lobe in the back here, which is the same as the cranium, and your temporal lobe. Some of the other features you can see from looking on the outside, you have your cerebellum. You can see your medulla oblongata, as well as your pons. And then we open it up here, we can get a little bit more in depth. Okay. Again, your frontal lobe, parietal lobe, occipital lobe, and you can see your temporal lobe from the back side there. We'll go ahead and start from the bottom down, some of the main features here. Up on top, you have your corpus callosum. Deep to that, you have your septum pellucidum. You have your fornix. You have your choroid plexus, which lies within the ventricles, which produces your cerebrospinal fluid. This portion here is your thalamus. You have your intermediate mass in the center there. This portion up front below is your hypothalamus. And anterior to that, you have your optic chiasm, or optic nerve. You have your mammillary bodies. In here we would have our infundibulum coming off, would be your pituitary gland. You have posteriorly back here your pineal gland, which lies inferior to your corpus callosum, but inferior to your corpora quadrigemina, superior to your corpora quadrigemina. Your corpora quadrigemina lies inferior to your brainstem here. It is made up of your superior and inferior colliculus. You have what lies here is your third ventricle, which comes down into your cerebral aqueduct to your fourth ventricle out your central canal. On our cerebellum here, this inner portion would be your arbor vitae, or tree of life. And what can't really tell in here, but you have your cerebellar cortex, which lines the outside of the cerebellum. Our brainstem here is made up of our mesencephalon, or midbrain. You have your pons up front, and your medulla oblongata inferior to that. Let's see.
Did you get the fourth ventricle, or lateral ventricle?
Well, lateral ventricle would be up here. Let's see some other features. Let's bring this back and we can discuss the 12 cranial nerves. Okay, 12 cranial nerves. We'll start up here. You have your olfactory nerve. You have your optic nerve, oculomotor nerve. Kind of have to look deep in here to see our trochlear nerve. We'll take this side off. You can see it here. Your trochlear nerve. Coming back up front, you have your trigeminal nerve, which lie lateral sides of the pons. Anterior to the pons, you have your abducens nerve. Coming lateral, you have your facial nerve. Going more lateral, you have your vestibulocochlear nerve. Inferior to that, you have your, we'll come on this side, you have your glossopharyngeal nerve. Inferior to that, you have your vagus nerve, only nerve to extend past the head and neck. And inferior to that, you have your accessory nerve here. Anterior to that, you have your 12th nerve, which is your hypoglossal nerve. So, take that. Here's a better view of the thalamus, hypothalamus, which make up your diencephalon. Below that, again, remember the midbrain, or mesencephalon. Inferior to that, you have the pons. Below that is the medulla oblongata, and once you pass the foramen magnum, it becomes the spinal cord. That sums up the majority of the brain here. Here you can see some openings where you have your lateral ventricles. Remember, your lateral ventricles are made up of your anterior, posterior, and inferior horn. Yeah. I think that sums up the brain.